Clark County Public Health is confirming 2 new cases of measles, bringing now the total of confirmed cases to 38, and that's with 13 more suspected cases.
And now we're learning more about how the agency is responding to the increased demand on its staff. Fox 12's Marja Martinez spoke with the public health director earlier. She joins us live from Vancouver with the cost of the outbreak. Marja?
Well, so far, I'm told this agency has spent more than $200,000 containing the spread of this virus, but that does not include how much the state has spent. That's another $250,000, and the cost just keeps rising. The mounting cost of containing a multi-state measles outbreak is taking a toll on resources and workers. Washington Governor Jay Inslee even declaring a state of emergency in all counties.
There's 2 more cases confirmed, so we're up to 38 confirmed cases and 13 suspect cases.
So far, the measles outbreak, which began in Clark County, has cost its public health department $207,000, according to Health Director Dr. Alan Melnick.
It doesn't include what the state is paying.
The Washington State Department of Health says it's spent $250,000 since the outbreak began, money it's diverting from other programs. Dr. Melnick says the money Clark County is spending on stopping the contagious virus from spreading is coming from a reserve account.
But eventually, there's a limit to what you can dip into that.
According to Dr. Melnick, the money is being used to pay staff, purchase supplies, cover lab tests, travel expenses, and other costs.
We're not close to the limit yet, but we're getting there.
The cost rising as quickly as the number of measles cases. Wednesday, officials identified 2 new possible exposure sites, Mountain Air Trampoline Park and Juniper Swim and Fitness, both in Bend, where infected children from Clark County traveled.
This not only puts a strain on us financially, but it also pulls people off from other work that they would be doing.
Dr. Melnick says staffing is the agency's biggest challenge, with half of its 110 workers normally tasked with restaurant inspections, researching communicable diseases, among other things, currently being diverted to answer phones in the measles call center, many working overtime.
One nurse had been working 12 days straight.
But Melnick says the Medical Reserve Corps and Washington DOH are stepping in to help with these exhaustive efforts, and the support is much appreciated.
All of our energy is being directed towards controlling this.
Dr. Melnick was asked several times if his staff has discovered the origin of the measles outbreak. He said that's an incredibly difficult task, and right now the agency's resources are all being devoted to just controlling the outbreak. He says once the staff has been able to do that, then they can get down to answering that question. Reporting live in Vancouver, Marja Martinez, Fox 12 Oregon.